Okay, we're going to move on to another area. We're going to talk about the Vastus Lateralis. Okay, this is a part on the thigh that we're going to inject into. Again, we're going to go through our whole processes. This is a whole new injection we're giving, so we've checked physician's orders, right? We've done our checks to the MAR. We have checked our medications. We're doing our rights and our checks. We're doing that 3 times, making sure we know documentation, making sure we know why we're actually giving this med. Does it make sense? Is it reasonable? I'm choosing the right needle, okay? This is an IM injection again, little longer needle, okay? And I've got my syringe, I've got my alcohol swipes, and I've got some gauze as well, all right? I've done my checks with my patient, I've talked to my patient. This is the desirable place that my patient would like you to put the medication. So that's fine. One thing that's important is, again, like I mentioned before, position your patient, ask your patient to move, all right? Don't contort your body to make this work. Ask your patient to move. And also with this and our next injection, make sure to maintain the dignity of your patient. All right, we're exposing some vulnerable areas here. So typically what I'll do is I'll take the blanket and I'll just pull it across the patient and just expose and tuck in this area that I need to do my injection in. All right, so when I'm looking at my Vastus Lateralis here, it goes along the whole thigh, all right, and we're breaking it into thirds, okay? So I'm actually taking my hand, just going just above the knee here, making this position, going just on top of the hip here, okay? And you can see the whole area I have in between my hands, okay? You can go all the way down this area. Then I take the top thigh and I break it into thirds. So I got 1/3, 2/3, and here's my other third. So just like Aaron had just told me, it's like a strip of duct tape going down here, okay? We try and shoot right for that center piece right there. So, got my gloves on again. I've done my hygiene, I've done my teaching. I do my landmarking. I landmark, I look, okay? I got my thirds. In my mind, I know where I'm gonna give this injection. I take my alcohol swab, okay? And I clean this area. Same thing, if I have to re-landmark, if I have to look again, my hands touch that, even if I have gloves on, I'm re-cleaning that area, okay? Clean, clean, clean. I allow the alcohol to dry. I have my label on my medication, okay? I am going to support this area with my hand. So I pull off my needle cap. I've got my long needle. I remember where I had cleaned. Don't put my fingers in it. I take my syringe, 1, 2, 3, poke. Nice clean movement in, not jerky, just nice clean with confidence. At this point, I shift my hand up to support, not touching the cleaned area, and I inject. 1, 2, counting to about 30 to 1 minute going in, dependent upon what volume I'm putting in and what medication I'm putting in. So I put in my medication, it's fully in, I wait 5 to 10 seconds afterwards, and I've got my gauze all ready as well, okay? And I just pull out, gauze, safety, sharps container. Typically I can ask my patient to hold this if they'd like, okay? Don't rub the area, just apply gentle pressure, all right? And that is how we do the Vastus Lateralis.